Hi everyone, thanks for listening to my presentations. Today I'll be talking about tuberculin skin test and interferon gamma release assay. That is, I'm going to give details of TST and Igra. If you haven't checked my other presentations on tuberculosis, please kindly do. I think I published about 4 or 5 different presentations. This is going to be the 6th one. So having this in mind, let's go. Note, we are not reading the redness or erythema when it comes to TST or Igra. We are reading only the induration, not the redness, not the erythema. Many people made that mistake, and they have subjected so many people to unwarranted further investigations, including unnecessary medication administration. We are reading only the induration, please, not redness, not erythema. Before having Mantoux test or Igra test, we need to take some brief history. First of all, this could be government regulation, maybe for purpose of anything the government has given the order, your jurisdiction, or the health authority, maybe for the purpose of hiring new staff, new nurses, new doctors, so on and so forth, and they request that these tests should be done, and we do that. And of course, you asked about history of tuberculosis in the past in this individual or contact with anyone with active tuberculosis, particularly pulmonary tuberculosis in the past, or this person has been given birth to in an endemic region with tuberculosis, or history of recent travel to and from an endemic zones of the world with tuberculosis. Of course, history of HIV. Many might not be truthful about this, but we just have to put that on record, right? Diabetes mellitus, chemotherapy, cancer, because the immunity could be down, and that will play a big role as per reaction and what we're going to get while studying the duration. BCG, I will not waste your time here. I have about 1 or 2 separate slides on BCG today, so I'll go to that right here in the next few minutes. Someone is having bladder carcinoma and the person is on intravesical BCG right now. We need to find out, because that will influence the result we are going to read to the next 2 or 3 days. Is this person on steroid for a long period of time, or glucocorticoids like prednisone for a long period of time? We need to know, because it's a very potent immunosuppressant. Disease-modifying anti-rheumatic drugs like infliximab, adalimumab, and the rest of them can suppress the immunity. Are we dealing with any renal pathology in this patient today? I need to know that. How about malnutrition or protein-losing enteropathy that will decrease the immunity, or this person has been working in a group home or long care home, or in prison, or in hospitals in the regions where there are lots of tuberculosis, endemic regions. We need to find out. And how about allergy? Allergy to purified protein derivatives. That is one of the agents we're going to use for TST, tuberculin skin test. Find out. Or this person had TST done in the past, and he or she had developed allergy, even anaphylaxis in the past. we need to know today so that we don't run into the same problem. And we need to find out, have you ever had interferon gamma release assay test done before? We need to know today before having the test done. Tuberculin skin test. This is a delayed type hypersensitivity reaction. It is mediated by T lymphocytes in anyone with prior mycobacterial exposure. That's why so many people would jump at the conclusion in being delayed they could see erythema or redness. And they, oh, yeah, you have TB before, you have latent tuberculosis infection, then the next thing is to have chest x-ray done, sputum and all this stuff, and then be looking for what is not there. An induration will be formed within 48 to 72 hours. Okay? We can use purified protein derivative or RT23. I'm making my presentations for everybody worldwide, so I'm not going to limit myself to what is available under the zone where I am. No, that's why I'm making this presentation in such a way that globally it could be acceptable and useful. Some are using RT23, while many are using purified protein derivative. It's given as 5 tuberculin units, 0.1 ml intradermally if you are using purified protein derivative. But if you are using RT23, you're going to use 2 tuberculin units. You can see the difference, right? Remember that we are using only Mantoux technique. Well, I remember when I was in medical school, we say Mantoux test or Heaf test. Heaf test is outdated right now, so we're using only the Mantoux test. Okay, get EpiPen or adrenaline. Somebody is saying, what is the difference between EpiPen or adrenaline? It's not different, but if you're in North America and Western world, EpiPen, yes. You are in some other Anglophone countries, adrenaline, correct. Okay, so like I said, my presentations are not meant for a region or a zone. It's meant for all health workers, all patients worldwide. That's why I use EpiPen. That is, if you're familiar with that, good. If you're not, if you hear adrenaline, say the same. So get EpiPen or adrenaline ready. Why? In case of any reaction, right? If you can read results between 48 to 72 hours, then you need to have a repeat. But you're not going to use the same forearm. So you use the other forearm that you didn't use the other time. If this patient or this individual that you're about to test had BCG in the past, there's likelihood of boosting today, particularly if this is done in greater than or equal to 7 days. We don't use Heaf test anymore. Well, I cannot tell, some people in some other parts of the world may still be using it, but now I leave that to what is obtainable at your jurisdiction. Okay, adverse reactions. Adverse reactions due to TST is very rare. I'm glad to know that. But there's that possibility of hypersensitivity. Not in many, but 1 out of a million. But who knows who that one could be? There's possibility of secondary bacterial infection. So discuss your testing and whatever results, either positive or negative, with the public health authority. Particularly if it is positive, you have to report. Okay, there is a repeat and serial testing. Repeat and serial testing, okay, no need to have a repeat testing if it is positive. The next thing is you do all other investigations, just X-rays, sputum, everything, to confirm if it is active or not. If negative, might be because of decreased immunity or the individual has been treated, then you have a repeat. A repeat will be necessary. Or certain medications like prednisone is identified, then stop that medication before you have the repeat done again. So if it is negative, okay, you have to repeat the test in 8 to 10 weeks. Not on the same arm and forearm, on the other forearm that you didn't use the first time. There's what we call two-step tuberculin. For those who have prior BCG, or they are health workers, or they have exposed themselves to someone with active pulmonary tuberculosis, actually coughing and have hemoptysis, okay, today you are going to test the person right. The forearm, you inject your purified protein derivative, and you tell the person to come back in 48 to 72 hours, right? Okay. A second test will be done on the opposite forearm. That is after 1 to 4 weeks after this very one today. The first test is done today, right? You read it a few hours later, 48 or 72 hours. Then almost 4 weeks after, tell the person to come back and you apply the same purified protein derivative on the other forearm. Then the B, that is your second test, can then form the first test of a serial testing. And then the second test you're going to do 4 weeks after the first will then form the basis of a serial testing that will follow about 10 weeks after. I know many people will send a lot of messages to me over this. Please pause and repeat, or let me repeat myself here again. For prior BCG or healthcare workers or someone who had exposed him or herself to anyone with active TB and coming for TST, tuberculin test today, okay, I will do the test today, maybe on the left forearm, right? The non-dominant arm anyway, so I'll do that today. Then I'll read in 48 to 72 hours. The second test will come up between 1 week and 4 weeks after the one I have done today. I will do the second test of the same purified protein derivative on the right forearm. Then that one on the right forearm will form the basis, that like the first test of a serial testing, because I will do a repeat in 8 to 10 weeks. Okay, the serial tuberculin testing now. The serial tuberculin testing will be necessary for healthcare workers. The reason is we just want to be double sure that they are not having latent tuberculosis infection that could become active later on. Might be because they later on become debilitated in any way, or they have diabetes, the disease-modifying antibiotic drugs, they have cancer, and they're on chemotherapy or radiotherapy, they're taking glucocorticoids or anything, or they lack, anything that will suppress immunity in them. Okay, so it's a two-step test, and we do this mostly for healthcare workers, and it entails essentially that TST will be administered If the result is positive, then don't worry. Do all other tests to rule out active tuberculosis. And if the outcome will prove that it's not active, then treat like latent tuberculosis infection. If the result is, however, negative, then we need a repeat test after 2 to 4 weeks. Okay? Some can decide to do that in 1 to 3 weeks. Then a serial testing will start, giving the second dose after 8 to 10 weeks. BCG and tuberculin test. Many people are confused about this. Even some nurses who grew up in endemic regions of the world who had taken BCG before, now visiting western parts of the world, then being screened. I will say, oh, I had BCG when I was a child. Get a fact here now. BCG and tuberculin test will have variable effects, particularly if you took that BCG as a child. Okay? Now, when you have become an adult and you are now given TST, there will be variable effects because you had BCG in the past. Normally, for the larger population of people who took BCG as children, if the BCG is more than 10 years ago, it should not be considered as a factor to dictate or influence the interpretation of the TST result today. If TST is done serially, an individual may have the first TST to be negative, and we call that faded immune memory. But because he or she had BCG before, there is what we call boosting. The booster phenomenon will trigger a positive reaction to the TST the second time the tuberculin test is administered. And what would that do? That would lead to a memory recall. Okay? You can perform the initial two-step testing to distinguish a true positive tuberculin test from boosting from any other reason to be positive. But here is the point. If you, as the clinician, you don't want stress, and the health worker who needs this or anybody who needs this testing doesn't want stress either, then the two of you can agree, let's do away with tuberculin skin testing. No preferred protein derivative, no RT23. Let's go straight for one test that BCG has no effect on. And what's that? Igra, interferon gamma release assay. Let's do that today. So, in conclusion here, as far as this slide is concerned, if somebody comes to me and the person has history of BCG and he or she is thinking because I had BCG in the past, I might be positive today, and I explain that no, you got a BCG when you were a kid and you are now 25 years old, I'm not going to think that that will have any effect on you. No. If somebody is saying that, or this person is a young woman or middle-aged woman or elderly woman having bladder cancer and is taking BCG intravesical injection and about to have this screening done, you know what? Either the first person that is having, doubt that BCG done 15 years ago will have effect, or the person that is taking BCG now for chemotherapy purpose, I would rather go for IGRA today. And with IGRA, no story about BCG. BCG has no effect on the result. If after 48 to 72 hours you reach the induration and you have less than 5 millimeters, well, don't think this is negative. It might be considered positive if there's HIV infection in this person, if this person has had contact with active contagious resident, client, or patient, if there's allergy, that is immune unresponsiveness. Immune unresponsiveness triggered by freezing T cell responses, pending the second signal from the antigen presenting cells. While the second signal will unfreeze that. It might be false negative if there's bad agent. For example, if you have used contaminated purifying protein derivative or contaminated RT23, or there's improper storage of the test agent when exposed to light and heat. In other words, don't allow the public health nurses and yourself to expose your testing agents to light and heat. How about error in administration? Intradermal is intradermal, not IM. Okay? Error in recording. Some will record erythema and will record redness, not induration. Or there's HIV that has suppressed the immunity, there's advanced tuberculosis overwhelmingly, or there's leprosy or pertussis, measles, mumps, rubella, live vaccination, including polio and yellow fever, immunosuppressant, chronic renal failure, malnutrition, cancers of the lymphatic and blood, and of course, less than 6 months old and greater than 75 years. Both sides of the age group, the extreme side, I mean, too young, too old, we have immunity suppressed, because too young, we have immunity that's not yet mature, and the older, we have the immunity that is waning down. Tuberculin skin testing interpretation, like I've said, viral protein derivative, Aplizol or Tuberculin, diagnostic agent, intradermal route, 0.1 ml or 5 international units of purified protein derivative. Mark the site of the injection. Okay, read between 48 to 72 hours. That is the standard. Okay, you've read, and it's greater than 5 millimeters. It is positive if the induration is greater than or equal to 5 millimeters in patient at risk for HIV, patient diagnosed with HIV or those having AIDS, close contacts with TB patients with chest X-ray confirmation, those that are having organ transplantation, patients on immunosuppressant like tissue necrotic factor alpha inhibitors, patients on chemotherapy, diabetic mellitus that have been diagnosed for a long period of time, on steroids like glucocorticoids, for example, prednisone for greater than or equal to 15 milligrams per day for more than a month. When we have all these situations and the induration is greater than or equal to 5 millimeters, that is positive. Possible causes of a decreased response could be TB infection, bacteria, fungal, viral infection, live viruses. Postpone the TST for 6 weeks if you have given live vaccinations before now. Don't run the TST today. Let the patient come back 6 weeks after. If there's malignancy, corticosteroid, immunosuppressant, all these will cause a decreased response, like even chronic renal failure, hypoproteinemia, afibrinogenemia, chemotherapy, HIV, and diabetes mellitus. In short, any situation that decreases immunity will let us have decreased response, and we might not get the right picture. If the result is greater than 10 mm, it is positive if this person is a recent immigrant from prevalent countries, but must not have arrived in greater than 5 years, which means the person has arrived just within the first day and 5 years. Okay? It's positive if this is a child less than 4 years. It's positive if this is an individual using IV drug, long-term care facility residents, workers at long-term care facilities, is having silicosis, renal failure, dialysis, cancers, and decreased weight. This is a prisoner or serve at the prison. This is homeless, mycobacterial lab workers. Yes, I need to repeat that. This person is working in the lab, okay, but working in microbacteriology lab and has done TST and is 10 millimeter, that is positive. Children less than 4 years old, adolescent, and all children exposed to adults with active tuberculosis. And of course, shelters dwellers for any reason, maybe domestic abuse or war or natural disaster. They are living in shelters, and you do TST and is equal to or greater than 10 mm, that is positive. Greater than or equal to 15 mm, it is positive. In anyone who has never had contact with any TB patient, or this person greater than 4 years old and no contact, no risk factors, and you do the test and it's greater than or equal to 15 mm. So in other words, anybody with no risk factors, no contact, you can have 5 mm, that is negative. You can have 10 mm, that is negative. But if you are now getting 15 and above, that is positive. So people without risk factors can have race induration, but must not be more than 15 mm. If it's greater, that is positive. How about false positive? It might happen that this person is having non-tuberculous mycobacteria, so not necessarily mycobacterial tuberculosis. Okay? This might be as a result of BCG. This may give less than 10 millimeters in duration, and really, you are not going to see this in anyone who had taken BCG more than 10 years ago. So let me break that down. The second point here. Somebody had BCG last year, 2 years ago, 5 years ago, and you are doing your TST today and is greater than 10 mm, might not have any latent TB. Honestly, may not. Might be the result of the BCG reaction. BCG at age 5 to 6 may cause a stronger and longer lasting false positive reaction. So those who took it as children, in either case, after 10 years, whether you took it as a child at birth or you took it when you were about entering the school, after 10 years, the effect of BCG making TST to become positive will wane down appreciably. But I've said it before now, and I'm rounding up on this note. If BCG is constituting headache for you and your client or your patient, stop TST, stop tuberculin testing. Just go straight for IGRA. If IGRA is positive, no debate. Refer for that test to rule out active TB. But if TST is negative and you are highly suspicious that this is not right, this is not true, you can repeat TST. And if it's still negative and you are still not convinced that you should let this person go, do IGRA. And whatever IGRA gives you, if it's positive, then it's positive. Then you better rule out active tuberculosis. But if IGRA is negative, you end it there. And with that, I end this presentation, please remember to share and subscribe to my channel. I appreciate it. Thank you.